Have you experienced popping or clicking or pain in your jaw? Perhaps you've been diagnosed with TMJ disorder. I'm Lori, and I'm a certified massage therapist here in California, and I focus on structural body work that helps realign my clients, helping them with their pain, either decreasing or eliminating it, and improving their range of motion. Occasionally, some of my clients come in with TMJ problems, and I want to share in today's video some of the information that I share with them. In today's video, we're going to discuss what TMJ disorder is, what are some of the symptoms, what actually causes it, what are some of the treatment options, and what are some of the self-care things you can do at home. TMJ stands for temporomandibular joint, and that joint is right here where the jaw, which is the mandible, attaches to the skull. So this joint helps us chew our food, yawn, talk, basically a lot of things we do every day. So TMJ disorder is when that joint becomes inflamed, dysfunctional, or misaligned. Symptoms of TMJ disorder include jaw pain and tenderness. You can also experience clicking and popping. And then also there can be a locking of the jaw, so you can't really fully open your mouth. And then also you can experience headaches and earaches and pain in the upper body, such as your neck and shoulders. Causes of TMJ disorder can include poor posture, especially when the neck is involved, like when the neck is off to the side a little bit, looking down a lot, anywhere where you're not in the center alignment and your head's off just a little bit. What that can do is it causes all this tension, which can go into the neck, and it actually pulls on the jaw, so that can really aggravate it quite a bit. Another cause is teeth grinding, which a lot of times happens at night, or clenching, which can be happening during the day. A lot of times we don't even know we're really tightening our jaw and holding on to that tension. So we can be thinking, we can be sitting in our computer, we can even be looking at our phone, and subconsciously we're just clenching our teeth for no reason, or if we're under a lot of stress, that can really do it as well. A few other causes include dental issues when there's a misalignment or there are missing teeth. That can do it as well. There can also be jaw trauma, where if there was an accident or an injury of some sort where the jaw was actually hit. And then also there can be arthritis in the joint, so there can actually be degradation within the joint and the muscles, the bones and the cartilage around the joint. That can also affect it as well. There are different treatment options for TMJ disorder depending on the cause. For instance, if it's based on a trauma or there is degeneration in the joint, you'll want to check with your physician regarding the best treatment options going that route for that situation. If the cause is due to a dental misalignment, you want to check with your dentist, because sometimes they can give you a mouth guard that has helped many people. If the cause is due to poor posture and there's a spinal alignment, a chiropractor might be a good option for you. And then also some people have great luck with physical therapists. They have great treatment plans too that can help the clients as well. Then also another great treatment option is massage therapy. Massage works great to loosen up the muscles of the jaw, either in the masseter or up in this area, in the temporal area. There are three things that I specifically like to use with my clients. There are three types of body work that's not just massage only. There's myofascial work, where you're actually working with the connective tissue and loosening that up. Especially if there's any scar tissue, if there's been an injury from a long time ago and that needs broken up, and it really gets in there and kind of realigns those fibers for the connective tissue. Then there's also craniosacral, and what craniosacral is it's very subtle technique. And what it does is it has to do with realigning of the cranial bones. Of course, our skull is not one big bone. There's multiple bones that make up the skull. And so what happens if those bones get slightly overlapped or slightly out of alignment, that can throw things off. So there's two techniques in craniosacral therapy that I know how to do. There's an occipital release and a mandible release that work really well for my clients with TMJ disorder. And then also Another thing I do with my clients is called trigger point work or trigger point therapy. So in our muscles, there are various trigger points that cause pain in those areas, and sometimes they'll cause referral points in other areas. And by going in there very slowly and just kind of sinking into the tissue, it helps deactivate those points, causing the area to release. So by combining all three of these, I've been able to help a lot of my clients with the TMJ disorder. Now I'll get into some self-care techniques that I also recommend to my clients that they can do at home to provide some relief. The first thing I recommend is either taking a big washcloth or small hand towel, wetting it, especially when you get out of the shower, wetting it, sticking it in the microwave for a little bit till it's nice and warm. You don't want it too hot because you don't want to burn your skin, but you want it warm enough to where that heat can really sink in. So once you get it warmed up and in the microwave, take it out and very, very carefully, like I say, make sure you double check the temperature before you put it on your skin, on your face. So then you'll take it and then you'll just encompass your jaw and put it in there and kind of really work that around. So that way you work into that muscle called the masseter. That's the muscle on the outside here. So, and then you can work down because there's muscles all along here that you can work into. You can even go up underneath and work those muscles a little bit. All the muscles around the jaw area that go up into it. And it works out really well to start loosening them, loosening the muscles for the next step I'll show you. The next thing I show my clients is using a tool such as a Gua Sha stone. I have a metal one here. A lot of times you'll see them on different retail sites where they're jade stone. There's different ones you can look into. And if you don't have one, I've also recommended using a very dull spoon if you can find one that works well. I find this metal one works very well for me as well. So what you want to do is just kind of strip up along that muscle, because this is kind of like a myofascial technique where you're realigning the connective tissue and the fibers. So what you can also do and just get in there and kind of open your jaw a little bit and then really work that back and forth, up and down, really get into close to that joint, and you'll almost feel like a band, like ding, ding, ding kind of thing. So you'll go in there and you'll just work it, and it can be quite painful. So you want to start light and then go deeper. So you'll go on each side of the jaw and really work that. And if you want, you can even go up just very lightly up into the temple and kind of in front of the ear where all that comes together. And another place to go is actually underneath. So you go underneath because there is actually muscles clear up underneath here on the jaw. And if you go up and turn to the side, you'll feel it. You'll feel like a really, really tight band. So very, very carefully work that, because the lymph nodes come out through that area for the face. So you want to be very, very careful in that area. And then just kind of work those muscles a little bit all around. And then another thing you can do is you can get clear up in the neck, because a lot of times the neck tension is also creating the jaw tension. So what you'll do is just keep working around. Go to the side, strip it down, go to the back, strip it down, and just keep stripping it down and come around and just keep working that area. And you'll find eventually it'll get less and less tender. So another thing you can do is trying to open up this area, especially when we work on our computers or sit at our phones. And so everything is just getting compressed because we're looking down, our neck's compressed, our connective tissue is compressed. So we want to get this opened up. So do some stretches and then take your chin and just really reach up and really get that stretch out like that. And you could even take your hands and go like that to help try to open everything up. And then you want to make sure to you could start taking your hand and just getting contact with your skin and then pulling down Just work your way around, get up in here, up in the, kind of by the ear, and pull down and go sideways. So what you're trying to do is connect with everything that can affect the jaw to get all of this opened up, get the backside opened up. And what that does is it takes some of the pressure and the pull off of the jaw. Another more advanced technique I show my clients that have pretty extreme TMJ disorder is I have them put a glove, or you can use your finger once you have it washed and everything. For demonstration purposes, and so you can see a little easier, I'm going to use a latex glove here. So you take your hand, take your finger, open your jaw, and what you're going to do, you'll kind of feel the muscle on the outside here. So you feel it right where it comes together. Besides the masseter, the big one that connects here, there's muscles underneath that. So you're trying to get to those muscles. So you can feel it from the outside, but you take your hand, and what you'll do is you go on the inside and go all the way back to the joint and then just rub it. And what will happen is it'll be extremely sore a lot of times. So just start really, really light, really slow, and then gradually work it even more and more. And as you're doing it, slightly open and close your jaw so that shortens and lengthens that muscle, so it helps it work even better. So like I said, you'll take your finger, go all the way back, feel that, it'll be very, very sore. So like I say, you work that muscle a little bit, and what you can do is at the same time, you can work on the outside. So you'll be able to feel that tension go all the way through. And then eventually it should get less and less sore for you and should feel better. You want to remember with the self-care techniques, you want to go slow and do it a little at a time. You don't want to get in there and force anything, because it can tend to make it worse, especially if you are experiencing a lot of pain. So you want to work with the body and really be in tune with it. You could do these massage points that I just spoke about for lunch, and then you could do it again before you go to bed, especially before you go to bed, because a lot of times if we don't relax the day out of our system, we carry that with us in our sleep. And so we don't really get a break because we get that pain spasm cycle going. Everything's tensed up. There's a soreness there. So we don't completely go into our deep sleep because the pain is keeping us awake enough that we're not sleeping, but we need our sleep in order to heal the pain. So there's definitely a cycle. So you want to relax and release that tension, especially in your jaw, as much as possible. Let me know in the comments about your TMJ disorder experience, and if there are different other techniques that I may not have covered that have also helped you and could help other people that's suffering from the same situation. If you found today's video interesting, please feel free to like and subscribe for future self-care tips.